Julie Ann Malzard, student number 222100373. To start off, I would like to acknowledge the Tagagal clan of the Durag Nation, the traditional custodians of the land on which we gather today. I pay my respects to the elders, past, present, and emerging, and extend that respect to any Aboriginal and Torres Strait Islander people here today. Today, I'll be focusing on cultural perspective practices within the hospital setting. I would like to highlight ongoing health disadvantages experienced by Aboriginal and Torres Strait Islander people. One key indicator is life expectancy. Based on 2020 to 2022 data, Aboriginal and Torres Strait Islander males have a life expectancy of 71.9 years compared to 80.6 years for non-Indigenous males. For females, it is 75.6 years compared to 83.8 years for non-Indigenous females, as well as higher rates for chronic diseases, limited access to healthcare education gaps, and overcrowded living conditions. Although culturally responsive practice is not always consistently provided in Australian hospitals, this can negatively affect Aboriginal and Torres Strait Islander people. Many Indigenous patients report experiences such as racism and stereotyping, feeling disrespected or ignored, poor communication from healthcare staff, and poor cultural understanding. Culturally responsive practice should be instead focused on respect, trust, communication, and cultural understanding. These negative experiences may lead Aboriginal and Torres Strait Islander people to feel unsafe or even judged within healthcare settings, which can lead to mistrust of healthcare services, delayed or avoided care, and disengagement from treatment before it is completed. I believe these highlights why culturally safe care is so important, as it directly impacts health outcomes and healthcare engagement. As per previous slide, these experiences can make patients feel unsafe or unwelcome within the healthcare settings. Like in John's situation, where he felt unsafe, disrespected, and disengaged from care due to his experience in hospital. This is concerning because avoiding or delaying any treatment can lead to progression of chronic conditions, such as heart disease and diabetes, like he has. As for me, culturally responsive practice means recognizing and respecting each person's cultural identity and adapting care to meet their needs. For nurses and midwives, culturally responsive practice involves being aware of our own assumptions and biases, communicating respectfully, actively listening to patients without judgment, building trust relationships, and addressing racism or discriminatory behaviors within the workplace. I believe it is important to understand that culturally responsive practice is not only something that we do at work, but also in our everyday life. This can include learning about Indigenous cultures and histories, using respectful language, speaking up against discrimination, and advocating for equity and inclusion. By doing this, we can help create healthcare environments where Aboriginal and Torres Strait Islander people feel safe, respected, and supported. In conclusion, this portfolio has highlighted how colonization, historical trauma, and culturally unsafe experiences continue to affect the trust that many Aboriginal and Torres Strait Islander people have in healthcare systems today. I discussed how racism, stereotyping, and poor communication can create barriers to healthcare and contribute to poorer health outcomes for Indigenous Australians and Torres Strait Islanders. I also explored the importance of culturally responsive practice and how nurses and midwives can help provide culturally safe and respectful care through communication, self-reflection, advocacy, and creating welcoming environments. As a nursing student, this portfolio has helped me better my understanding with the importance of cultural safety and the role of healthcare professionals play in building trust and improving healthcare experiences for Aboriginal and Torres Strait Islander people. Thank you.